increasing threat of monkeypox raising the urgent need for a fresh approach. The centre has summoned a meeting of top health experts today. This comes as another foreign national has tested positive for monkeypox in Delhi. The fourth such case in the national capital. The patient is a 31-year-old woman from Nigeria. It is not yet known if she travelled abroad recently. Altogether, 9 cases of the disease have surfaced in India, all in Kerala and Delhi. Now, I'm joined by my colleague Anshul with more details on this. Anshul, what will be discussed in this key meeting, and can we as citizens see some measures being put in place? How well do masks curb the spread of the disease, perhaps?
Definitely, Shilpa. So we have seen that over the past few days, almost 9 cases have come in India, out of which 5 cases are in Kerala and 4 in the national capital. Just yesterday, a woman from Nigeria has also tested positive from monkeypox. She has shown a few symptoms, and she is admitted at the LNJP hospital in the national capital. So yes, the threat of monkeypox seems to be increasing, especially in the national capital, when more than 4 cases have already come over here. However, the symptoms of monkeypox are still not very clear, and there is not a very clear guideline that has come out from WHO. Because in London, in England, we saw that around 197 men had tested positive. So the initial perception was that this is something that transmits in men. But however, now we are seeing that many women, be it in Africa, be it in London or England, or be it in India itself, women have also started testing positive for monkeypox. So yes, today the meeting that is going to take place by the senior officials of the Indian government, that representatives from the WHO are also going to join in that meeting, where the discussion would happen on the larger spectrum of symptoms that arise in all these patients, the common symptoms that arise in all these patients, and what are the preventive measures. Because remember, this is a very new disease that has come to the fore, even in front of the WHO. So yes, the cure as well as the restrictions that need to be put in place to stop the spread of monkeypox is still not very clear from WHO as of now. So yes, the representative of the WHO will also be present in today's meeting, where he'll be giving the Indian government a broader idea of on what lines is the WHO thinking, and in what lines can the WHO actually go out to curb the spread of this disease. However, in the national capital, we have seen that the experience that we had during the coronavirus pandemic, be it the first wave, second wave, the experience that we have, at least the Delhi government is now trying to put in place the measures that it wants to make sure that the situation that we saw happen during the second wave that does not arise. That is the reason why we heard Delhi's Deputy Chief Minister Manish Sisodia just a few days ago coming out and saying that beds have already been reserved for monkeypox patients in Delhi's government hospitals, and not only government hospitals, but 3 to 4 private hospitals in the national capital have also reserved beds for patients that could have monkeypox. So yes, the measures are in place, but yes, this meeting that is going to happen today is going to be very crucial. We might actually get a new set of guidelines as to how to curb the spread of monkeypox, and what is the action that needs to be taken to curb monkeypox in patients who are turning up positive. Till now, 4 patients have already turned positive. Many of them have had travel history from outside India, but yes, at least three people in the national capital do not have any travel history, which means that there could be local transmission in this as well. So yes, this meeting that is happening today is going to be very crucial, and we are going to get a much clearer idea of what is the future course of action that is going to be taken to stop the spread of monkeypox, but also to find a clear path of cure for this very dangerous disease.
Thank you very much, Anshul. We'll be waiting for those guidelines, and you'll update us as and when they come. For now, be satark, be savdhan, everyone. And on that note, take a very short break.